Hello, good morning, everyone. Just letting folks come on into the room before we get started. Okay, I'm seeing the numbers slow down a little bit, so I will go ahead and get started here. Hi, everyone. Thank you for joining this webinar on the expenditure reporting form for the California opioid settlements. My name is Audrey Richardson Salinas, and I work for the Rare Health Group. We're helping DHCS facilitate today's call. Next slide, please. For housekeeping, if you have any technical questions, please send a direct message to Millie Patel from the Aurora team, and she can help you troubleshoot any issues you're having on Zoom. I also want to note that today's meeting materials will be available on the DHCS website following the conclusion of this webinar. Today's webinar is going to also provide some opportunities for questions, and DHCS will focus on questions that are going to be applicable for all cities and counties. If you have a specific spending plan question or expenditure form question for the DHCS team, we do recommend that you contact the team at osf@dhcs.ca.gov or complete a TA request form available on the DHCS Opioid Settlements website. Any questions that we don't cover today will be compiled into a Q&A document and also posted to the website as well. Additionally, the DHCS team will be hosting office hours over the next several months during the reporting period to answer any specific questions from cities or counties. Next slide, please. This slide actually provides some information on previous informational webinars that the DHCS team has hosted over the past 2 years, which we do encourage you all to review. These provide information about how settlement funds are allocated, how to work with local opioid coalitions, allowable expenditure uses, and then also reporting requirements as well. They are all available on the DHCS Opioid Settlements webpage, and please keep in mind that webinars that were covering prior versions of the expenditure reporting form will be superseded by the guidance that is given today. Next slide, please. In terms of our agenda, today's webinar, DHCS will provide an update on California's opioid settlements and bankruptcy agreements. The team will also provide a high-level summary of the financial reporting survey results that many of you had completed earlier this year. DHCS will then review the updated reporting form, concentrating on the elements of the form that have been changed and updated for this new reporting season. Finally, there will be an opportunity for questions, again at the end, for participants to ask any questions of the team. And we'll conclude this presentation with next steps and also an overview of available resources on the DHCS Opioid Settlements website. Next slide, please. Now that housekeeping is over, I'm going to turn things over to Heather Gardner from the Department of Healthcare Services, who will walk you all through an overview of the settlements and the reporting requirements. Heather is a unit chief in the substance use disorder section of DHCS, which is tasked with overseeing use and reporting requirements of the settlement funds among cities and counties. Heather, I will pass things off to you.
Thanks, Audrey. So since our last reporting session, there have been a few updates on the opioid settlements and bankruptcies. Next slide. The settlement with Kroger is considered final and payment is forthcoming. Payments received from this settlement will not be included in this reporting period. Additional settlements with HCMA, Amneal, and Purdue are also pending and will not be included in this reporting form. The state will continue to update cities and counties on the status of these settlements. Next slide. This slide provides an overview of the payment structure of the settlements. Note that the settlement payment structure has not changed, and the pending settlements previously discussed are anticipated to follow the same structure. A quick reminder on the allocation and uses here. The California Abatement Accounts Fund must be used for future opioid remediation uses listed in Exhibit E. In addition, at least half of the California Abatement Accounts Fund must be spent on high-impact abatement activities, which can be found in the relative California state subdivision agreements, as well as on the DHCS opioid settlement webpage. The California Subdivision Fund can be used towards future and past opioid-related expenses, which can include litigation fees and expenses. This fund is only allocated to those cities and counties that were initial plaintiff subdivisions. If a city or county does spend money on litigation, it must be reported to Brown Greer. It's important to note here that Brown-Greer refers to these expenses as non-opioid remediation uses. However, DHCS refers to these expenses as past opioid-related expenses. Finally, the California State Fund is used by the state for future opioid remediation. Statewide activities are determined by the state legislature and subject to normal budgetary processes. Next slide. The Mallinckrodt bankruptcy payments concluded in state fiscal year 2023-24. However, if your subdivision has not yet expended or reallocated all of the Mallinckrodt bankruptcy funds, you must continue to report on your remaining balances, even if no new expenditures or interest earnings occurred in state fiscal year 24-25. We encourage local governments to expend their Mallinckrodt bankruptcy funds, which will then decrease their reporting burden. ENDO has also made a payment to cities and counties, but the annual reporting is not required as these funds are not under DHCS oversight. Next slide. We'd also like to provide a reminder on the NOAT 2 payment structure. The payment structure for the second payment from the Mallinckrodt bankruptcy is the same as the first payment. Specifically, the majority of funds were distributed directly to cities and counties. The local government share must be used for future opioid remediation uses listed in Exhibit 4 of the Mallinckrodt bankruptcy plan. This is the same as Exhibit E in the National Opioid Settlement Agreements. Monies dispersed to the state through the NOAT 2 state share must be used for opioid remediation. Uses for these funds are determined by the state legislature and subject to normal budgetary processes. Next slide. DHCS will continue to be the oversight entity for cities and counties as they receive funds from the settlements in bankruptcy. The responsibilities of this oversight include monitoring the California cities and counties for compliance, designating additional high-impact abatement activities, conducting related stakeholder engagement, and preparing annual reports. As a reminder, DHCS does not make payments to cities and counties. All settlement payments come from Brown-Greer, and Mallinckrodt bankruptcy payments come from NOAT 2. Any questions regarding allocations or payments should be directed to those entities. On behalf of the local governments receiving Mallinckrodt funds through NOAT 2, DHCS collects payment and expenditure information, which is then reported by DHCS directly to NOAT 2 annually. Next slide. In addition to the status updates, we would also like to remind folks about the reporting requirements for the settlements in bankruptcy. Next slide. Cities and counties receiving funds from the opioid settlements and Mallinckrodt bankruptcy are required to complete annual reporting to DHCS. This includes any funds that are rolled over or unspent, encumbered, or expended. Like in the prior reporting period, DHCS will review the submitted reports, prepare an annual written report regarding the state, city, and county's use of funds, and host an annual meeting to share the report findings. This process will continue each year until all funds are fully expended and for 1 year thereafter. DHCS is currently working on the annual report for the state fiscal year 2023-24 and will produce a similar report for future state fiscal years. As a reminder, the California state fiscal year is July 1st through June 30th each year. Next slide. First, in this reporting cycle, cities and counties will be asked to report on payments and expenditures during state fiscal year 24-25, which ran from July 1st, 2024 through June 30th, 2025. Cities and counties must report on payments received from distributors, Janssen, Teva, Allergan, CVS, Walgreens, and Walmart. Cities and counties with unspent Mallinckrodt funds must also report on those funds despite no new payments being made. Also, as a reminder, reporting is not required for the McKinsey settlement or the ENDO bankruptcy. Cities and counties in receipt of McKinsey or ENDO funds will not include those payments or expenditures on their annual reporting form. Next slide. Before we review the payment and expenditure reporting expectations for this state fiscal year, we would like to take a moment to review some of the feedback we received from you all. So I will now turn it over to my colleague, Jennifer Davis, Section Chief of the Opioid Settlements Oversight Section, who will walk us through the results of the Financial Reporting TA survey.
Thank you, Heather. And thank you to all of the city and county representatives who completed the TA survey form on financial reporting. Next slide. There were a couple of themes we saw across the TA survey responses. Many respondents spoke to experiences with frequent staff turnover and time constraints, difficulty developing and implementing effective tracking systems, and wanting more clarity with requirements on reporting. Respondents also shared the need for additional resources on expenditure rules and requirements, along with more TA and Q&A opportunities. We want to thank you all again for your feedback, which is helping us brainstorm, make updates to the annual expenditure reporting form, and identify opportunities for future tools and support. Next slide, please. We wanted to share a preview of some of the planned supports and resources based on challenges identified through the TA survey. Many respondents wanted to see clearer descriptions and examples of high-impact abatement activities. Our team is working to develop fact sheets with detailed descriptions for each high-impact abatement activity, including examples, and a webinar series to share additional insights on these activities. Cities and counties also mentioned they are experiencing difficulties understanding the differences between numerous settlements and bankruptcies. We're working on drafting a simple one-pager that will showcase the reporting requirements, eligible uses, and any other relevant details for each settlement and bankruptcy. As discussed on the previous slide, cities and counties also share challenges with frequent staff turnover and knowledge transfers between staff. With that in mind, the department is working to develop a yearly opioid settlement funds training webinar that will review the basics and serve either as an orientation or a refresher for city and county representatives. We also heard that cities and counties are looking for best practices for tracking funds and are working to brainstorm resources to assist with the complex task of tracking funds from multiple settlements and bankruptcies, including a worksheet that can be used to help track your opioid settlement funds. Next slide, please. Cities and counties shared their insights into our technical assistance process and requested additional forms of TA outside of the TA form. We're working to build more frequent touch points for office hour sessions and webinars throughout the year, in addition to the TA form, which remains accessible on the DHCS website. As a reminder, cities and counties may at any time submit a TA form to our main inbox, which is then routed for research and review. Cities and counties also shared challenges distinguishing between indirect and direct costs, calculating the 50% HIAA or high impact abatement activity threshold requirement for abatement account funds, understanding expenditure timeframes and spend down requirements, and understanding definitions within the settlement. We are actively working to refine our behavioral health information notices and glossaries to further clarify and outline policies around the settlements and bankruptcies. These documents will be available for stakeholder feedback within the next few months. In the meantime, you can always email our main inbox, osf@dhcs.ca.gov, with any questions you may have and review the current resources currently published on the California Opioid Settlement webpage. Next slide, please. Regarding the expenditure report, DHCS analyzed common questions, challenges, and other difficulties experienced by cities and counties with the initial reporting forms. This feedback was used to update and improve the current reporting form to reduce challenges for staff completing the form. We've highlighted a few of the challenges and updates here. First, cities and counties expressed difficulties tracking and reporting funds received by separate settlements. On the updated reporting form, which we will go over in more detail in future slides, we'll now have payments reported by fund type, meaning abatement and subdivision funds, rather than by individual settlements. Next, cities and counties reported that it was difficult and burdensome to calculate interest by settlement, as interest generated is typically kept within one account. Beginning on this year's updated reporting form, interest will only be reported as a combined lump sum across all funds received and to be used for future opioid abatement activities. We were also made aware that the past reporting form included restrictive character limits that didn't always provide enough room for cities and counties to expand on areas, such as high impact abatement activity justifications. We've expanded the character limits throughout those key areas and have also added a functionality to upload supporting documentation. Next slide, please. And finally, cities and counties mentioned wanting the form to be more user-friendly with simpler ways of navigating during the reporting process. Our team has incorporated navigation buttons to help with the ease of working through the form, and we are exploring additional features to improve the functionality of the reporting form. Next slide, please. Next, there are several details we would like to note for cities and counties before we walk through the updates to the state fiscal year 24-25 expenditure reporting form. Next slide, please. Sorry. With these updates, the state fiscal year 24-25 expenditure reporting form will contain the following structure. First, cities and counties will indicate which opioid settlements they receive payments from, either directly or through reallocations. Cities and counties will then include contact information for the individual completing the form. Please remember not to use personal contact information, as these will be made public. This includes phone numbers and email addresses. Where applicable, cities and counties will be asked about their total payments and interest earned from the California Abatement Accounts Fund, California Subdivision Fund, and Mallinckrodt Bankruptcy. Where applicable, cities and counties will be asked about any reallocations to or from another participating subdivision. Cities and counties will then be asked about their expenditures from the California Abatement Accounts Fund, California Subdivision Fund, and Mallinckrodt Bankruptcy. And finally, the form will end with an attestation section where the preparer will sign and submit the form on behalf of their city or county. As a reminder, individual city and county reports will be published along with the state's annual report on the DHCS California Opioid Settlements webpage. Next slide, please. Similar to previous years, only one person should prepare and submit the expenditure reporting form on behalf of their city or county. The preparer does not have to complete the reporting form all at once. The reporting form can be returned to if the same browser is used and if cookies and history have not been deleted from that browser. We encourage cities and counties to have the data saved elsewhere prior to entering their information in the reporting form in case there are any technical glitches with saving. A Word version of the reporting form will be provided so cities and counties can collect all data before entering it into the online reporting form. Please note that all reporting must be completed online. Next slide, please. In addition to this presentation, there are additional support documents available to cities and counties. It is recommended to review the expenditure reporting form document and collect all data before starting the online reporting form. The opioid settlements expenditure reporting form necessary materials checklist can serve as a guide for the information you will need before starting the expenditure reporting form. The opioid settlements expenditure reporting Q&A document has questions DHCS has received regarding the form and answers that we have provided. Exhibit E outlines allowable opioid remediation uses. This can also be found in each of the national settlement agreements or Exhibit 4 in the Mallinckrodt bankruptcy documents. And finally, a list of payments made to participating subdivisions can be found on the DHCS opioid settlements webpage. Payment information is provided to DHCS by Brown Greer for settlements and NOAT 2 for the Mallinckrodt bankruptcy. This payment list is maintained as a courtesy by DHCS so cities and counties can easily identify their payment amounts. Next slide, please. Next, we will walk through a preview of the updated sections of the online expenditure reporting form. Our team will share a video walkthrough of the full reporting form during the reporting period, and we will alert cities and counties when that resource is available. I will now turn it over to my colleague, Nancy Kitzmiller, Unit Chief in the Opioid Settlements Oversight section, who will walk us through a preview of the updated reporting form.
Thank you, Jenny. Next slide, please. Section 2 asks you to select whether your city or county received funds from opioid settlements. Selections here will ensure that your city and county complete only the required sections based on your allocations. Additional settlements have been added to this list as payments have been made in the state fiscal year 2024-25. This section will also ask your city or county to indicate if it is a plaintiff subdivision. If you have questions about your city or county status, check with your counsel representing your city or county on opioid matters. Next slide, please. The Mallinckrodt bankruptcy subsection will cover bankruptcy funds received from NOAT 2. You must report if your city or county has ever received Mallinckrodt bankruptcy funds and any portion of those funds remain unspent, unreported, and not reallocated in prior fiscal years. As a reminder, Mallinckrodt bankruptcy payments have concluded and no future payments are expected. We encourage cities and counties to spend their Mallinckrodt funds because once fully spent, you will no longer need to report on these bankruptcy funds. Next slide, please. Payments pertaining to the California Abatement Accounts Fund. This subsection will cover any payments received from the California Abatement Accounts Fund. Unlike prior years, cities and counties will report a lump sum for all abatement payments that are received. As a note, more than one payment may have come from one settlement. Both payments, if received in 2024 and 2025, should be added to this total. If you are unsure about your total payment amounts, DHCS maintains a courtesy list on the California Opioid Settlements webpage that includes dates payments were made to cities and counties. Next slide, please. Section 2, payments regarding the Special Master Awards. Plaintiff subdivisions may have received a payment noted as a Special Master Award of subdivision costs in the state fiscal year 2024-25. If so, you will need to report on this payment received. However, DHCS will not be collecting expenditure data for these payments as they are reimbursements for an awarded costs. However, you will need to report these to Brown Greer directly as well. Next slide, please. California Subdivision Fund payments. This subsection will cover any payments received from the California Subdivision Fund. Again, unlike prior years, cities and counties will report a lump sum for all subdivision payments received. As previously mentioned, more than one payment may have come from one settlement. Both payments, if received in 2024-25, should be added to this total. Next slide, please. Payments, interest earned. The interest earned subsection will cover interest earned on all funds from all settlements and bankruptcies, including the Abatement Accounts Fund, Subdivision Fund, and/or Mallinckrodt bankruptcy. Only interest accrued in the state fiscal year 2024-25 should be reported. Please do not include any interest that has previously been reported. This interest will be used to support your future opioid abatement projects. Unless explicitly expressed to DHCS to do otherwise, DHCS will use oldest abatement account funds first, or in other words, spend down payments that cities and counties have received that are closer to the end of their expenditure periods and therefore more at risk of being returned to the state. Next slide, please. Section 3, reallocations. Section 3 will cover any reallocations of funds between cities and counties. Reallocations do not include funds that are redistributed to a county by Brown Greer due to a city opting out of direct payment. For state fiscal year 2024-25, we have updated this section to reflect lump sum reporting and remove the column that previously required cities and counties to break out reallocations by individual settlement. Reallocations will be reported separately for California Abatement Account Funds, California Subdivision Funds, and Mallinckrodt bankruptcy, and your interest earned. For California Abatement Funds, the year of initial disbursement from Brown Greer will be used to calculate periods of expenditure for spending of the reallocated funds. As a reminder, funds will need to be spent or encumbered within 5 years of the initial disbursement or 7 years for capital outlay projects. Otherwise, they are at risk of being returned to the state. Interest earned that is reallocated will now be reported as a lump sum, which is a total across all settlement and fund types, including the mountain crop bankruptcy. Next slide, please. Section 4 will ask cities and counties to provide a breakdown of direct and indirect costs for a specific abatement accounts fund activity and indicate if you previously reported encumbered funds included in the direct or indirect costs being reported above. There is a separate question inquiring about newly encumbered funds for this activity. If your city or county decided to encumber funds for this activity during the state fiscal year 2024-25, you would fill out that amount separately. As a reminder, encumbered funds are sums of money that have been formally committed to a specific allowable future project or activity through either a signed contract, a purchase order, approved budget, or another formal process at the local level. Simply expressing that you have encumbered funds on the reporting form does not inherently encumber funds. This is a local process. Also, another reminder that direct costs are costs that can explicitly be identified with a particular cost objective, whereas indirect costs are administrative expenses incurred for a common or a joint purpose that may benefit more than one cost objective and are not readily assignable to a direct cost objectives. For additional information on direct and indirect costs, please see the DHCS Administrative Cost Policy on the California Opioid Settlement webpage. Next slide, please. Section 5 will ask cities and counties to identify how the activity aligns with an expenditure type. This is for California subdivision funds. Cities and counties will be asked to select which allowable expenditure type within the definition of opioid remediation most aligns with their activity. The definition for opioid remediation can be found in the national settlement agreements and may include projects that address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, or mitigate the other alleged effects of, including on those injured as a result of the opioid epidemic. Next slide, please. And here I'll hand it off to you, Audrey. Thank you.
Apologies, couple technical difficulties on my side here. Okay, perfect. Thank you so much, Nancy. So again, we will take a break to answer any questions from folks. I know a lot of questions have already come in, so thank you for the folks who have already submitted their questions. Please continue to submit any questions that you have in the Q&A feature on Zoom, and we'll continue to kind of go through this list here. But I know to start us off, many folks are saying that there's a lot of really great information in this slide deck and wondering if presentations or the recordings will be posted to the website. These definitely will be posted to the DHCS Opioid Settlement website. And to my rare team, if folks don't mind dropping in the link to that website, I know we have a couple new folks here today, and so we'll drop a link to that website in the chat so you will have that. Our goal is always to have these recordings and slide decks posted pretty closely after the webinar, and so in the next couple of days, definitely keep a lookout, and we'll be sharing an email as well once those are posted. Let's see, in terms of other questions, I know there's a few clarifying questions regarding the conversation around future and prior expenditures, trying to kind of work out when expenditures are considered future opioid remediation uses versus reimbursement for past opioid remediation uses. Someone in the chat has a great example here of if their city or county had expended funds in 2024 and are reporting during this season, are those funds that were expended in 2024 considered past expenditures or future opioid remediation expenditures?
It largely depends on the project itself. We have expenditure reports that, will include projects that are spanning multiple years. And if it's all part of one project, there are times where an expenditure occurring in the previous fiscal year may be reported in the next fiscal year, which we would not consider a reimbursement. Reimbursements are also largely for subdivision funds. This is kind of particular to our plaintiff subdivisions. So there's a couple of questions I would need to ask before really being able to make a determination there. We recommend submitting a TA form for those specific types of questions.
Thank you, Jenny. And we have a few folks here, again, I think joining a little bit later into the webinar here, but just curious regarding the due date for expenditure forms. Is that going to continue to be September 30th for this upcoming reporting season?
Yes, that's correct.
Perfect. Let's see. I know there's also some questions regarding the high impact abatement activities. One question here, I think, again, Jenny, you might have mentioned this during your part of the slide deck, but just wondering if there's going to be additional guidance materials regarding those high impact abatement activities. And if DHCS can kind of speak a little bit more about that.
Yeah, definitely. We've heard cities and counties are having challenges with determining whether or not their expenditures and activities are eligible for high impact abatement activities. So yes, we do have some planned resource documents that will likely go out after our policy documents have been published, just to make sure those resources align with the policy guidance that we have in those bins, the behavioral health information notices. But we do plan on doing kind of I don't want to say a deep dive, but including what we have noticed to be kind of pain points with these high impact abatement activities and kind of sorting through them individually between all 6 of those high impact abatement activities. You can kind of think of them as kind of like HIA 101s for each activity. And we do intend to include examples that we have received in terms of approved or accepted expenditures that have met the criteria for those 6 high impact abatement activities, because we think it will be helpful to see kind of some real world examples of ones that have determined to be eligible. And they will be published to our California Opioid Settlement webpage.
Thanks, Jenny. Another question around HIAs for the team. I think, Jenny, as you're speaking about having these kind of a little bit more concrete examples, folks are wondering if there's any information that you can currently provide regarding youth prevention presentations and media campaigns. So really thinking about interventions that are much more prevention focused, and if that kind of activity would fall under HIA activity number 5, which is interventions to prevent drug addiction in vulnerable youth, or if that might possibly fit under HIA activity number 3, which is all about addressing the needs of communities and vulnerable youth.
Yeah, again, it depends. We recommend you submit a TA form. A lot of these activities do need some research and review to determine where it best fits, if any, in the high impact abatement activities. I will say we have seen HIA number 5, which is the interventions to prevent drug addiction in vulnerable youth. That has been one that we have had our eyes on, as it does not seem to be very clear to a lot of the cities and counties. So that will be kind of discussed in our policy documents that will be coming out shortly after the stakeholder review. Also will be part of the resource documents. But for any specific questions like that, we do recommend you go through our TA process because we do research and review them to provide the best information possible.
Thanks. And then another question regarding the high impact abatement activities, kind of stepping back from these more nuanced examples. Folks are wondering if the team can explain a little bit about the changes regarding the 50% requirement of abatement account funds being spent on HIA. Folks are specifically wondering, is the requirement based off a fiscal year basis? Is it possible to, say, spend more on a high impact abatement activity up front, just knowing that some programs have a little bit more upfront costs as well?
Yeah, that's a really good question. And unfortunately, the settlement agreements aren't very specific in that regard. If I recall, it says in each calendar year DHCS does operate on a state fiscal year, which is July 1st through June 30th. I think what will end up happening is a 50% threshold for all abatement accounts funds. Meaning in total, that seems to be the way we'll have to kind of calculate that. We do recommend keeping that threshold in mind each year when you get payments. However, you can spend 100% of your abatement accounts fund and report 100% that is eligible for an HIAA. And then in subsequent years, maybe 0 is spent. We do recommend keeping tabs on it, meaning we don't get too far down the line and you've almost run out of abatement accounts fund payments. And even if you end up spending 100% on those last couple of payments, decades in the future, you are at risk of not meeting that threshold. So we do recommend if you have any concerns, you can reach out to the main inbox, submit a TA form so we can review your project before it's implemented, and give you our feedback as to whether or not it meets the criteria to be eligible for those HIAA. But we are here to help you and assist in that.
Thanks, Jenny. Talking about tracking of payments or funds being expended, a few folks have questions regarding the change in reporting the payments received. And so folks wanted to clarify in terms of kind of tracking these payments and reporting on them, that they no longer necessarily have to split out payments by settlement, and it's only regarding the abatement fund versus the subdivision fund. Can you all talk a little bit more and clarify that as well?
Yes, that is correct. But also the Mallinckrodt bankruptcy, which, correct me if I'm wrong, we still have separated out on the expenditure reporting form. So it'll effectively be your California abatement accounts funds, your California subdivision funds, if you're a plaintiff subdivision, and then the Mallinckrodt bankruptcy. And in between those, you will not be separating out by settlements as we had on previous reporting forms, such as Janssen distributors. You will no longer be separating them out by settlement.
And then a few folks have questions regarding tracking interest and reporting on interest as well. One individual notes that their county has been tracking interest by settlement, and it seems like the new report kind of aggregates interest across all settlement and bankruptcies. Wanted to just clarify if their understanding is correct.
Yes, that's correct. It will be reported as a lump sum. And that's true for your abatement accounts funds, your subdivision funds. Again, it'll be all inclusive amongst those fund types and not separated by settlement type.
Thanks, Jenny. We have a couple questions on reallocations as well. I know a couple individuals have flagged that they are curious of a clarification for Section 3. So when they're working in this reallocation section of the reporting form, do they need to report funds that are automatically reallocated to a county? So say their city opted out of payments from the directing administrator, do they need to report on those reallocations as well?
It depends on how we're using reallocation here. So it sounds like you're asking if your city or county has opted out of direct payment, meaning you did not receive that payment, then no, you will not be reporting on that. If it's a reallocation that occurred, meaning you received the payment and then you sent it back or sent it to the city and county you've reallocated to, that you will report on.
Thanks for that clarification, Jenny. Just looking through some additional questions here. There is a question regarding special master awards. Specifically, this individual asked, what agencies would have received the special master's award? Is there a list of agencies that have received these funds that folks can refer to?
Yeah, we will have them if we don't already, those payments on our DHCS website. There's a handful of them and they're all plaintiff subdivisions because this is kind of a payment or a reimbursement that's reserved for our plaintiff subdivision. But yeah, you can check. And Nancy, Heather, do we have that updated payment list currently? It sounds like the payment list that we currently have published does have those. You can see they're clearly notated as special master's award costs. So you can check there to see if your city or county received one.
And then let's see, a few folks are noting that they are definitely interested in this technical assistance or TA form process. Wondering if the team can talk a little bit more about how folks access the TA form and then just a general kind of overview of what to expect in that process.
Sure. Yeah, I'll go ahead and pass that over to Nancy and Heather. They're the ones that are directly reviewing these TA forms.
So the TA form can be found on our webpage under the Technical Assistance and Resources tab. It provides you a lot of resources on that webpage that we ask that you review prior to submitting your TA form, just so that you can be well informed on the processes for these funds. But when you complete the TA form, you'll just indicate what type of funds you received. If you would like an activity to be reviewed, there's sections for that, how it aligns with Exhibit E, whether or not you think it's HIAA. And then there's a final section that is just kind of a free space for you to ask questions. If you have questions about financial reporting or tracking or any of those types of questions can be filled out on that last page of that TA form.
Thank you, Nancy. And folks are also asking if for whatever reason they end up getting kind of disconnected to GHCS in this process, what's the best way to reconnect with the team?
Our main inbox, I think, will be the quickest way, osf@dhcs.ca.gov, if I'm understanding the question correctly.
I believe so. Jenny, I believe this question is around during the TA process, say, I think if for whatever reason they're wondering just to confirm if you all received the request or just following up on different questions, just the best way to reach you all. So it sounds like the OSF inbox is still correct.
Yes, that's correct. And we do typically around the reporting period time, we do see kind of an influx in these TA reporting forms. So we just ask that we will confirm that we received it, and if there is any reason why we don't think we can get it back to you in a timely manner, it's usually because it needs a bit more research. We will let you know and stay connected with you.
Thanks, team. Let's see. And so folks, again, are just clarifying in terms of the difference here from the previous reporting period and this current reporting period in new form. Folks are wanting to clarify. So it sounds like reporting is really focusing on payments and expenditures for the abatement fund, the subdivision fund, as well as the mountain crop bankruptcy. And then also kind of having this kind of separate lump sum interest payment. Is there any other payments or allocation types that folks should be aware of and expect for this reporting form?
For this reporting form, I believe those are all that you will be reporting on. So I believe the settlement payments that went out, and Nancy, Heather, correct me if I'm wrong, there will be Janssen payments, distributor payments, and you will also be reporting on any unspent Mallinckrodt payments, although we don't expect to see any future Mallinckrodt payments, which is why we really urge you to go ahead and spend those funds, just because it will relieve some of your reporting burden, and you won't have to report on Mallinckrodt bankruptcy funds, just the other ongoing settlements. But yes, ultimately that is correct. It'll be the lump sum reporting for the California Abatements Fund, the California Subdivision Fund, Mallinckrodt, and then a lump sum for interest earned, which we're hoping makes this reporting period a bit easier than it has been in prior reporting periods, with the different settlement types and then the fund types underneath that.
Thanks, Jenny. Nancy, I saw you unmuted, wanted to check in if there's anything to add on your end.
I just wanted to add that not only is it the Janssen and distributor, but this past fiscal year, we received those additional settlements that were finalized, the CVS, Allergan, Walmart, Walgreens, and Teva, I believe. I believe that there's 7 altogether now. They were on a previous slide, but those will all be listed on our opioid settlement expenditure reporting form.
Thanks for adding that as well, Nancy. I'm seeing in the chat as well, folks kind of giving out kudos and really appreciate just the updates and the changes to the reporting form. Again, I know the DHCS team is very, very excited and very thankful that you all have filled out the survey. We also encourage you to continue to kind of fill out any of those surveys or attend listening sessions that we have. It is really the best way to be able to understand what's happening on the ground and really being able to respond as best as we can in terms of some difficulties that y'all are facing. But definitely appreciate the initial feedback from folks. It sounds like these updates are really exciting for a lot of folks on the ground, which is great to hear. Let's see, in terms of another question here, we have a question regarding how to track the correct dates in terms of when payments are received. So there seems to be some potential delays that cities and counties are experiencing between maybe what's posted as a payment on the payment list that Brown Greer provides or that DHCS posts on the DHCS website and when those funds are actually received. I know that has happened a couple of times in the past. So folks are wondering if they have that experience, what's the best way to go about making sure that their city and county, DHCS and Brown Greer are all on the same page of when funds were actually received, or if those funds were ever reversed by the directing administrator.
Yeah, that's a really good question. I think if there's a substantial delay between the date you can find on the payment list we have on our webpage and the date that you received it, I would reach out to that main inbox and give us some of that info. Unfortunately, I don't know if a one-size-fits-all answer will be appropriate here. I think we'll typically align ourselves with the date the payment is sent, but it depends on what happens to that payment. If it was reversed, returned, if something happened there, we will probably want to discuss that with you to determine the best way to put that on the expenditure reporting form. Otherwise, if there's just a simple couple day delay, I would align yourself with the date that the payment went out on the payment sheet. And I'm going to pass it over to Nancy and Heather just to make sure I did not provide feedback that goes against what they've been telling folks in the inbox.
No, that's exactly right, Jenny. Thank you. Yeah, that's correct. We do match the reporting that the cities and counties send to us with the payment data that we have uploaded onto our website. So definitely go with that for your reporting. There have been a very few subdivisions who did have an issue with payment, and usually those are already those have already been made aware to Brown Greer, and there's already been something happening. And so we're already in the loop on those. But certainly if there's anything that's kind of out of the ordinary, you're seeing a payment on here and you're not reflecting it in your account, definitely reach out to us and let us know and we'll work with you.
Thanks, y'all. And talking about kind of connecting with DHCS, I have seen a couple questions come in. Very exciting actually to see these questions come in of folks saying, you know, during last reporting period, they were able to connect with a specific DHCS staff member to just kind of work through their questions on the reporting form or just general questions they had on allowable expenditures. Folks are interested in is that going to be offered again as well, having their kind of own DHCS specialist to connect to, and if so, how do they get connected to that person?
Yeah, shortly after the cities and counties submit their reports, there is a little bit of a delay. UCLA processes them and then provides them to DHCS. And depending on how many reports we receive at once, you'll be contacted by your analyst as quickly as possible. But there could be delays based on how many reports get submitted altogether. But your analyst will reach out. They will set up a meeting to discuss your report, whether everything was fine or whether corrections need to be made. It'll also be another good opportunity if you do have payment issues, payment dates, things like that, to connect with your analyst who can elevate the issue and supply information as far as how we're tracking it. So it'll be a great touch point for all of the cities and counties. There have been a couple changes within our unit and our staffing. So it's possible that the person reaching out to the cities and counties won't be exactly the same as last year if you were affected by these changes in our staff, but you will be connected with somebody. And if you need that information prior and you've reached out and didn't have any success reaching your analyst, you can always email the inbox and we can connect you with your assigned analyst.
Thanks, Nancy. So again, everyone, once you submit that reporting form, you will have an analyst reach out to you. So definitely keep a lookout for those emails and definitely stay connected with that person just to make sure as they're reviewing your form and answering any questions that y'all can get anything resolved. I know a few folks are also already exploring the website, which very, very excited that y'all are connected on that website and already kind of working through that as we're talking. A few folks have noticed the current kind of support documents for the reporting form are for the older reporting period. Just want to acknowledge that the team is working on posting the updated form, and there will be an email once all those kind of documents are updated, as well as this reporting and slide deck as well. So just definitely keep a lookout for all of that information, but thank you for flagging that as a question here as well for folks. Let's see. And then we just have a couple more questions here. Folks are wondering when they will get access to the reporting form proper. I'm curious if the DHCS team can kind of talk about that process as well.
Sorry, I think I missed that question.
No worries. How do folks access the reporting form? And when will they be gaining access to the reporting form?
The reporting form, the resource documents or the actual online reporting form? That will open, the actual online reporting form will open July 1st. That is our target date, and a link will be sent out to access that. The resource documents will be available on our DHCS webpage, ideally before that. But I know we are coming very close to that July 1st target date.
Definitely. And then Jenny, another question for the team here. Folks are wondering regarding their endo bankruptcy payments, and just again confirming that the endo bankruptcy does not need to be reported through this reporting form, one. And then another question is where, if at all, they need to report those funds.
That's correct. Endo will not be reported to DHCS. Any payments or expenditures related to that bankruptcy will not be included on this or any future online reporting forms. There were no, well, I shouldn't say that. I would check in the settlement, those agreements. We are not that oversight entity. I'm not sure if there is another one. I have not heard. So I would check with either your outside counsel or your city or county attorney that is doing handling any opioid related matters. And also just check the verbiage that is in those agreements. But DHCS is not the oversight entity for those funds.
I just want to chime in real quick and put the reminder that the same is true for McKinsey for the settlement.
Yes, McKinsey will also not be included on this reporting form or future reporting forms, as DHCS is not that oversight entity.
Thank you all for that clarification. It looks like we have time for just one more question here. It looks like folks have a question regarding the addition of potential high impact abatement activities to that high impact abatement activity list. I know the team had discussed that the high impact abatement activities initially came from the state subdivision agreements, and then DHCS is able to add but not remove from those abatement activities. Folks are interested in DHCS's process of adding additional HIA activities, and then if the team has any plans on adding additional ones in the next year.
Yeah, that's a really good question. It might not be for those that are new to maybe new in your city or county as a representative. HIA number 6 is actually one that we added. What we did is we basically put it out to the city and county representatives to see if they were in agreement to add HIA number 6, which is basically increasing naloxone in our communities. So it was determined that, you know, most of us were in agreement that we could add that as HIA number 6. So we kind of made it official in our policy documents. And I just want to note that because some of the state subdivision agreements, which list the HIAA, came before we added HIAA number 6, you'll see that it only lists 5 in those settlement documents, and then future ones that came out after we included HIA number 6 is a list of on that list of HIAA. It is included in those, but HIA number 6 is and it's a high impact abatement activity for all current finalized settlements, even if it does not appear in that state subdivision agreement. This authority comes to us from Government Code 12534. And there is the potential for additional high impact abatement activities to be added, but it will be a fairly democratic process to make sure that the activities we are interested in including is something that city and county representatives are also interested in including. Right now, I don't believe we are romancing any ideas. However, that could change. And if it does, we will definitely kind of bring it up as a discussion point.
Thanks, Jenny. And I think another, just one last kind of follow-up into that, and then I think we can wrap up the webinar today. I do want to be respectful of folks' times, but kind of in that same vein, if folks have potential ideas that they would like to float to DHCS in terms of potential activities, is that possible? And then how would they go about kind of floating those ideas to you all?
Yeah, absolutely. I would recommend using our main inbox. The people on the call right now are the ones that monitor it. So if you have an idea, feel free to send it to us in an email, osf@dhcs.ca.gov.
Thanks, Jenny. And to the rare team, if y'all could drop that email in the chat as well. Again, I know folks are joining at different times, and just want to make sure folks are able to easily copy and paste and kind of record that information. I think we'll go ahead and wrap up here. So Elizabeth, I can ask you to progress to the next slide. That would be great. And then again, perfect. And one more time. Thank you so much. All right, so thank you all again for all the questions. Really great questions today, and definitely appreciate all the just engagement and participation that everyone is bringing. Again, as a next step, the reporting form is going to be sent to all city and county representatives on Tuesday, July 1st. And we'll also include, again, just the reminders of when all these resources are posted, so you all have those links available on the webpage. As a reminder, only one report should be submitted by your city or county, so definitely connect with your different representatives to collect the information that you need to complete the report. We'll also be adding in a Word document version of the report, so you can definitely kind of use that to connect with your other city and county representatives just to gather that information. Again, the report's going to open on July 1st, and then you have until September 30th to complete it. Next slide, please. Also wanted to flag again, really appreciate the opportunity to connect with y'all and hear again what's happening on the ground and any type of concerns or difficulties that y'all are facing. We again really appreciate y'all's feedback in terms of the TA expenditure reporting form survey, and definitely want to continue to keep touch bases with you, especially with this new reporting form version. And so following the reporting period, definitely keep a lookout in your emails for any kind of invitation regarding listening sessions. Again, we really want to hear how these integrated versions from your initial rounds of feedback went, if there's any still sticking points that are a little bit difficult, and again, just trying to coordinate and workshop together as much as we can in terms of really making sure that we're creating a reporting form that's as user-friendly as we can for you all, and then also make sure that everyone is in a good spot in terms of making sure that they're meeting their reporting requirements. Next slide, please. And of course, as we were speaking about through this whole presentation, there is a lot of really great information on the DHCS opioid settlement webpage. Definitely dropping that in the chat I see now as well, so definitely grab that link. And of course, as Jenny and Nancy and Heather were saying, definitely feel free to reach out to the team at the OSF DHCS inbox, which we have here on the screen as well. And then of course, we do have that technical assistance request form. So if you have really specific questions regarding allowable expenditures or wanting to talk about future plans that your city and counties are interested in pursuing, definitely fill that out and send that off to the DHCS team just so y'all can connect and really workshop again some good ideas in terms of how to spend these funds and how to impact your communities in the best way possible. Next slide, I believe, is the end here. So again, thank y'all so much. I know we were right at time, so thank you for sticking with us. We will let y'all go. Again, we'll send emails out when that reporting form is updated, as well as the supporting documents on the DHCS opioid website. But until you hear from us, hopefully you all have a good rest of your week and take care.